All right, today we're talking about your body's master regulators, the kidneys. I mean, think about them. They're this incredible filtration system, just quietly working 24/7 to keep everything perfectly in balance. So, what happens when that silent, vital work just stops?
Yeah, what does happen when your body's master filter breaks down? Let's dive in and investigate that. We're going to look at two totally different ways things can go wrong. One is a sudden dramatic crisis, and the other, a slow, quiet decline.
So here's the plan. We'll kick things off with that sudden crisis, an acute injury. Then we'll pivot to the slow decline of chronic disease. After that, we're going to zoom in and decode the signals the kidney's tiny filters are sending us. We'll even cover a super common infection, the UTI, and then wrap it all up by looking at how we can get things back in balance.
All right, first up, the sudden crisis. We're talking about a situation where the kidneys just stop working. It can feel like it comes out of absolutely nowhere, and in the medical world, this is called an acute kidney injury, or just AKI for short.
The key word to remember here is abrupt. Seriously, this is not a slow burn. It's a rapid, complete shutdown. And when that happens, all these toxic waste products like urea start building up in the blood, fast. It pretty much throws the body's entire chemical balance into total chaos.
So, if you're a doctor faced with this, how do you even begin to figure out what's going on? Well, you play detective. You look at three main areas. First, could the problem be before the kidney? Something like a drop in blood supply. Or is the problem in the kidney itself, some kind of direct damage? And finally, you check after the kidney. Is there a blockage somewhere that's stopping urine from getting out? It's a process of elimination. Okay, so we've seen the sudden crisis. Now I want you to completely shift gears. Picture the exact opposite. We're not talking about a sudden crash, but a slow, creeping decline. Something that can go totally unnoticed for years. And that is chronic kidney disease.
So what makes it chronic? Well, unlike the lightning-fast onset of AKI we just talked about, the single biggest defining feature of chronic kidney disease, or CKD, is time. For a doctor to make the call, the problem has to have been going on for at least 3 months. But honestly, it's often been developing quietly in the background for way longer than that.
And this is where you can really see the difference between the two. One is this sharp, sudden drop-off. That's your acute kidney injury. But the other, chronic kidney disease, is this gradual, slow slide downwards over a really long time. The clues don't stop there either. If you look at a scan, with AKI, the kidneys are usually a normal size. But with chronic disease, after all that time, they've often become small and shrunken.
And make no mistake, this isn't just a kidney problem. When your kidney function declines over years, it creates a domino effect throughout your entire body. We're talking a much higher risk of heart disease, something called renal anemia, because the kidneys can't make a crucial hormone for red blood cells. It can weaken your bones, drive up your blood pressure, and even make you more likely to get infections. Okay, now let's put on our microscopic goggles and zoom way in. Inside each one of your kidneys, there are about 1 million of these tiny, intricate filters called glomeruli. Think of them as the real workhorses. So, when these specific filters get damaged, they start sending out very clear distress signals. And that whole situation has a name, glomerulonephritis.
So when these filters start acting up, it usually happens in one of two main ways. You can think of it simply as an inflammatory problem versus a leaky problem. With nephritic syndrome, the filters get inflamed and angry, and that makes them bleed. So, the biggest clue? Blood in the urine. On the other hand, with nephrotic syndrome, the filters become super leaky, and they start letting massive amounts of protein escape from the blood into the urine.
And you can actually see the difference in how these two problems show up in a person. The inflammation from nephritic syndrome can trigger a reaction all over the body, like the kind of inflammatory rash you see here. But with nephrotic syndrome, that massive loss of protein from the blood causes a completely different issue. Fluid starts to leak out of the blood vessels and into the tissues, causing this really significant swelling, which you can often see first around the eyes.
Now, for doctors, the real smoking gun is found by looking at the urine under a microscope. What you're seeing here is something called a red cell cast, and it is exactly what it sounds like. It's a clump of red blood cells that have been packed together so tightly inside the kidney's tiny tubes that they've formed a mold, a cast of the tube itself. If you find one of these, it is a dead giveaway for the kind of inflammation happening in nephritic syndrome. So, with all these clues to look for, how do doctors keep them all straight? Well, there's a handy mnemonic they use, PHARO. Each letter stands for a different clue. You've got P for protein in the urine, H for hematuria, which is that key sign of blood. A for azotemia, or waste products building up in the blood. R for those red cell casts we just saw. O for edema and oliguria, meaning swelling and low urine output. And the last H stands for hypertension, high blood pressure.
Okay, let's step back from the complex stuff for a second and talk about something incredibly common, something many people have experienced, a urinary tract infection, or a UTI. Now, a lot of the time we think of this as just a bladder problem, right? But it can actually have really serious consequences for the kidneys.
So what exactly is a UTI? It's pretty simple. You have the classic symptoms, and there's bacteria hanging out where it shouldn't be in your urinary system. Now, docs classify them into two types. If the infection stays down in the bladder, it's a lower UTI, or cystitis. But, and this is the important part, if those bacteria decide to travel upstream and reach the kidneys, it becomes an upper UTI. That's called pyelonephritis, and believe me, it's a much more serious situation.
So who's the main troublemaker here? What's causing all these infections? Well, it's not much of a mystery. A whopping 80% of UTIs are caused by one single culprit, E. coli. And the crazy thing is, it's a bacteria that's normally supposed to be in our gut, just minding its own business. Okay, so we've spent a lot of time looking at what happens when things go wrong. Now, for the final part of our journey, let's look at the solutions. How does modern medicine step in to restore that delicate balance when the kidneys just can't do their job anymore?
When kidney failure gets really severe, dialysis becomes an absolute lifesaver. But it's a big step. So how do doctors know when it's time to make that call? Well, they have another great mnemonic for this, the vowels, A, E, I, O, U. It helps them remember the most urgent reasons. A is for acidosis, when the blood gets too acidic. E is for electrolyte problems, like dangerously high potassium. I is for intoxication from certain drugs. O is for overload, that is, fluid overload, or edema that isn't getting better. And U is for uremia, when those waste products start affecting the brain or the heart.
For people who need long-term kidney support, there are basically three main roads you can go down. First, there's hemodialysis. That's the one you probably picture. You go to a hospital or clinic a few times a week and get hooked up to